Question 1. The audit findings indicate a pattern of delayed reporting of potential orthopedic emergencies by orthopedic technologists. A patient presents to the clinic with severe, unrelieved pain in their casted limb, accompanied by numbness and tingling in the distal digits, and the cast appears excessively tight. The orthopedic technologist on duty recognizes these as concerning signs. What is the most appropriate immediate course of action for the orthopedic technologist? Option A. Immediately notify the supervising orthopedic surgeon of the patient's symptoms and request urgent evaluation. Option B. Document the patient's complaints thoroughly and wait for the orthopedic surgeon to review the chart later in the day. Option C. Attempt to loosen the cast dressing and reassess the patient's pain level after a short interval. Option D. Advise the patient to elevate the limb and apply a cold pack, then document the findings for the next scheduled appointment. Correct answer is A. Immediately notify the supervising orthopedic surgeon of the patient's symptoms and request urgent evaluation. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a critical orthopedic emergency where prompt and accurate assessment is paramount to patient safety and optimal outcomes. The technologist is faced with a situation requiring immediate action, potentially under pressure, and must rely on their knowledge of emergency protocols and patient presentation. Misjudgment or delay can lead to significant patient harm, including permanent disability or increased morbidity. The challenge lies in distinguishing between a true emergency requiring immediate intervention and a less critical situation that may require a different management pathway, all while adhering to established professional standards and institutional policies. Correct approach analysis. The correct approach prioritizes immediate patient assessment and communication with the supervising orthopedic surgeon. This aligns with the core principles of patient care and professional responsibility for an orthopedic technologist. Promptly assessing the patient's vital signs, pain level, neurovascular status, and the integrity of the dressing/cast is crucial for identifying the severity of the emergency. Escalating concerns to the surgeon ensures that the patient receives timely medical evaluation and intervention by the most qualified individual. This approach upholds the ethical duty of care, the principle of beneficence, and adheres to the scope of practice for an orthopedic technologist, which includes recognizing and reporting potential emergencies. It also reflects compliance with general healthcare regulations that mandate timely reporting of patient deterioration. Incorrect approaches analysis. One incorrect approach would be to delay reporting to the surgeon while attempting to manage the situation independently, perhaps by adjusting the dressing or administering pain medication without direct orders. This is a regulatory and ethical failure because it exceeds the technologist's scope of practice, potentially delaying definitive medical management by the surgeon. It also violates the principle of non-maleficence by risking further harm through inappropriate intervention. Another incorrect approach would be to dismiss the patient's complaints as minor discomfort without a thorough assessment or to assume the symptoms will resolve on their own. This demonstrates a failure in professional judgment and a breach of the duty of care. It neglects the potential for serious underlying issues, such as compartment syndrome or vascular compromise, which are orthopedic emergencies. Ethically, this is a failure of vigilance and beneficence. A third incorrect approach would be to focus solely on documenting the patient's complaints without initiating immediate communication with the supervising surgeon. While documentation is vital in an emergency, it should be concurrent with or immediately follow the escalation of care. Prioritizing documentation over immediate patient assessment and communication with the physician is a failure to act in the patient's best interest and can be seen as a dereliction of immediate duty in an emergency situation. Professional reasoning. In orthopedic emergencies, professionals should follow a systematic approach. 1. Recognize the potential emergency. Be aware of the signs and symptoms of common orthopedic emergencies. 2. Assess the patient. Conduct a rapid, focused assessment of vital signs, pain, neurovascular status, and the affected limb. 3. Escalate care. Immediately communicate findings and concerns to the supervising orthopedic surgeon or designated medical personnel. 4. Follow orders. Implement the surgeon's instructions promptly and accurately. 5. Document. Thoroughly document all assessments, communications, and interventions. This framework ensures that patient safety is prioritized and appropriate medical management is initiated without delay, adhering to professional standards and regulatory requirements. Question 2. Investigation of the most appropriate method for assessing passive range of motion in a patient 48 hours post-total knee arthroplasty, considering the need for objective measurement while respecting patient comfort and surgical precautions. Option A. Gently but firmly guiding the limb through the maximum possible range of motion, regardless of patient feedback, to obtain a definitive measurement. Option B. Using palpation to estimate the joint's available range of motion without direct measurement. Option C. Asking the patient to actively move their knee through its perceived range of motion and recording their subjective description of the movement. Option D. Employing a goniometer to measure the degree of flexion and extension, ensuring the limb is supported and movement is slow and controlled, stopping if the patient reports significant pain or resistance. The correct answer is D. Employing a goniometer to measure the degree of flexion and extension, ensuring the limb is supported and movement is slow and controlled, stopping if the patient reports significant pain or resistance. Explanation. This scenario presents a professional challenge due to the inherent variability in patient presentation and the need to adhere to established clinical standards while ensuring patient safety and accurate data collection. The registered orthopedic technologist, ROT, must balance the need for comprehensive assessment with the patient's comfort and the potential for exacerbating their condition. Careful judgment is required to select the most appropriate method for assessing range of motion (ROM) in a postoperative knee patient, considering the specific surgical intervention and the patient's current healing stage. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based method that minimizes risk and maximizes diagnostic accuracy. Utilizing a goniometer, when appropriate and safe, allows for objective, quantifiable measurement of joint movement. This aligns with the professional responsibility to provide accurate and reproducible data, which is crucial for tracking progress, informing treatment adjustments, and communicating with the surgical team. Adherence to established protocols for ROM assessment, including patient preparation and technique, ensures consistency and reliability of findings, thereby upholding the standards of care expected of an ROT. An incorrect approach that relies solely on subjective patient reporting without objective measurement fails to meet professional standards. This approach is ethically problematic as it can lead to inaccurate assessments, potentially delaying appropriate interventions, or leading to over- or undertreatment. It also neglects the ROT's duty to gather objective data. Another incorrect approach that involves forceful manipulation to achieve a specific ROM measurement, despite patient discomfort or contraindications, constitutes a breach of patient safety and ethical conduct. This disregards the principle of do no harm and can lead to iatrogenic injury, violating professional obligations to protect the patient. A third incorrect approach that uses an inappropriate tool or technique for ROM assessment, such as relying on visual estimation alone for critical postoperative measurements, introduces significant potential for error and undermines the reliability of the assessment, failing to meet the standard of care. The professional decision-making process for similar situations should involve a thorough review of the patient's operative report and postoperative orders to understand the specific surgical procedure and any limitations or precautions. This should be followed by a clear communication with the patient to explain the assessment process and elicit their cooperation and comfort levels. The ROT must then select the most appropriate assessment tool and technique based on the patient's condition, the type of ROM being assessed, active, passive, or active-assisted, and established clinical guidelines. Throughout the assessment, continuous monitoring of the patient's response is essential, with the ability to modify the approach as needed to ensure safety and accuracy. Question 3. What factors determine the most appropriate orthotic management for a pediatric fracture, considering the child's ongoing skeletal growth and joint development? Option A. The preference of the parents for a particular type of brace, regardless of its developmental suitability. Option B. The child's current skeletal maturity, the specific location and type of fracture, and the potential impact of the orthotic device on growth plates and joint congruity. Option C. The availability of off-the-shelf orthotic devices that can quickly immobilize the affected limb. Option D. The need to minimize the child's immediate discomfort and allow for rapid return to pre-injury activities. The correct answer is B. The child's current skeletal maturity, the specific location and type of fracture, and the potential impact of the orthotic device on growth plates and joint congruity. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the registered orthopedic technologist, ROT, to balance the immediate needs of a young patient with the long-term implications of their developing skeletal system. The ROT must consider not only the current injury, but also how interventions might impact future growth and joint function, a responsibility that extends beyond simple technical application of orthopedic devices. This requires a nuanced understanding of pediatric orthopedics and a commitment to patient-centered care that prioritizes long-term well-being. Correct approach analysis. The correct approach emphasizes a comprehensive assessment that includes understanding the child's specific growth stage, the nature and severity of the injury, and the potential impact of the chosen orthotic intervention on ongoing bone and joint development. This aligns with the ethical duty of care for orthopedic technologists to provide interventions that are not only effective for the immediate condition, but also promote optimal long-term musculoskeletal health. It reflects a commitment to evidence-based practice and a thorough understanding of pediatric physiology, ensuring that decisions are made with the child's future growth and development as a primary consideration. Incorrect approaches analysis. One incorrect approach focuses solely on the immediate reduction of pain and immobilization of the fracture, neglecting the critical aspect of growth plate integrity. This failure to consider the impact on epiphyseal plates can lead to long-term deformities, limb length discrepancies, and premature osteoarthritis, violating the principle of non-maleficence and potentially contravening professional standards that mandate consideration of developmental factors. Another incorrect approach prioritizes parental preference for a specific type of brace, without a thorough clinical evaluation of its suitability for the child's developmental stage and injury. While parental involvement is important, the ROT has a professional obligation to ensure that the chosen treatment is medically sound and developmentally appropriate, rather than simply acquiescing to requests that may not be in the child's best long-term interest. This could be seen as a failure to exercise professional judgment and uphold the standard of care. A third incorrect approach involves selecting a standard, adult-sized orthotic device for a child without appropriate modifications. This disregards the unique biomechanics and growth patterns of pediatric patients. Such an approach can lead to improper fit, skin breakdown, and inadequate support, potentially hindering normal bone and joint development and failing to meet the specific needs of a growing skeleton. This represents a failure to adhere to best practices in pediatric orthotics and a disregard for the principles of proper device selection. Professional reasoning. Professionals should approach such situations by first gathering all relevant clinical information, including imaging, patient history, and physical examination findings. They should then consult current best practice guidelines and literature pertaining to pediatric orthopedic care and growth plate physiology. Collaboration with the supervising orthopedic physician is crucial to ensure a shared understanding of the treatment goals and potential risks. Finally, the decision-making process should be documented thoroughly, outlining the rationale for the chosen intervention and how it addresses the child's immediate needs while safeguarding their future growth and development. Question 4. When evaluating a patient presenting with concerns about bone health and provided with their medical history, including a family history of osteoporosis, a sedentary lifestyle, and a recent bone density scan indicating osteopenia, which of the following represents the most appropriate next step for the registered orthopedic technologist, ROT, in the U.S. regulatory framework? Option A. Inform the patient that osteopenia is not a significant concern and no further action is required at this time. Option B. Recommend specific weight-bearing exercises and dietary changes without consulting the supervising physician or considering the full diagnostic report. Option C. Document the findings and refer the patient to their primary care physician for further evaluation and management of potential osteoporosis, ensuring all diagnostic data is clearly presented. Option D. Advise the patient to immediately begin a calcium and vitamin D supplement regimen without further consultation, based on the osteopenia diagnosis. The correct answer is C. Document the findings and refer the patient to their primary care physician for further evaluation and management of potential osteoporosis, ensuring all diagnostic data is clearly presented. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the registered orthopedic technologist, ROT, to synthesize information from multiple sources, patient history, diagnostic imaging, and laboratory results to formulate a comprehensive understanding of osteoporosis risk. The ROT must then translate this understanding into actionable advice and treatment recommendations, adhering strictly to the established regulatory framework for orthopedic technologists in the U.S. The challenge lies in balancing patient-centered care with the precise application of diagnostic criteria and treatment guidelines, ensuring all actions are within the scope of practice and align with patient safety and regulatory compliance. Correct approach analysis. The correct approach involves a systematic evaluation of all provided data, cross-referencing patient-reported risk factors with objective diagnostic findings and established treatment protocols. This aligns with the U.S. regulatory framework for healthcare professionals, which emphasizes evidence-based practice and adherence to established diagnostic and treatment pathways. By considering the patient's lifestyle, medical history, and bone density scan results in conjunction with current clinical guidelines for osteoporosis management, the ROT ensures a holistic and compliant assessment. This approach prioritizes patient safety and optimal outcomes by ensuring interventions are tailored to the individual's specific risk profile and diagnostic status, as mandated by professional standards and regulatory bodies governing orthopedic technology in the U.S. Incorrect approaches analysis. One incorrect approach would be to solely focus on the patient's reported symptoms without corroborating diagnostic evidence. This fails to meet the regulatory requirement for objective assessment and could lead to misdiagnosis or delayed appropriate treatment, violating professional standards of care. Another incorrect approach would be to recommend a specific pharmacological treatment without consulting the supervising physician or adhering to the established treatment algorithms. This exceeds the scope of practice for an ROT and bypasses the physician's ultimate responsibility for prescribing medication, a clear regulatory and ethical breach. A third incorrect approach would be to dismiss the findings of the bone density scan because the patient reports no pain. This ignores critical diagnostic information and contravenes the principle of evidence-based practice, potentially leading to undertreatment of a serious condition and failing to meet professional obligations to accurately assess and manage patient conditions. Professional reasoning. Professionals should adopt a systematic, evidence-based approach. This involves 1. Thoroughly reviewing all available patient data, including subjective reports and objective findings. 2. Consulting relevant clinical guidelines and regulatory requirements for diagnosis and treatment. 3. Collaborating with the supervising physician for diagnosis confirmation and treatment plan development. 4. Clearly communicating findings and recommendations to the patient and the healthcare team. This structured decision-making process ensures all actions are compliant, ethical, and patient-focused. Question 5. Strategic planning requires the orthopedic technologist to anticipate potential patient outcomes when selecting an immobilization technique for a complex tibial plateau fracture in an elderly patient with limited mobility. Which of the following approaches best reflects a proactive and patient-centered strategy for immobilization? Option A. Opting for a standard long leg cast applied with minimal consideration for the patient's pre-existing mobility limitations or potential for edema, focusing solely on fracture alignment. Option B. Selecting the most rigid casting material available to ensure absolute immobility of the fracture site, regardless of patient comfort or potential for skin breakdown. Option C. Utilizing a minimally invasive external fixation device that offers adjustable stability and allows for easier access for hygiene and skin care, while carefully considering the patient's ability to manage the device. Option D. Prioritizing a splinting technique that allows for early range of motion of adjacent joints, even if it slightly compromises immediate fracture stability, with close monitoring for any signs of displacement. The correct answer is B. Selecting the most rigid casting material available to ensure absolute immobility of the fracture site, regardless of patient comfort or potential for skin breakdown. Explanation. Scenario analysis. This scenario presents a common challenge in orthopedic technology, balancing the immediate need for effective pain management and fracture stabilization with the long-term implications of immobilization on patient function and well-being. The challenge lies in selecting the most appropriate immobilization technique when multiple options exist, each with potential benefits and drawbacks. A technologist must consider not only the biomechanical stability of the fracture, but also the patient's overall health, lifestyle, and potential for complications such as joint stiffness, muscle atrophy, and pressure sores. This requires a nuanced understanding of the principles of immobilization and their application in a clinical context, moving beyond a purely technical application to a patient-centered approach. Correct approach analysis. The correct approach prioritizes a comprehensive assessment of the patient and the fracture, followed by the selection of an immobilization method that offers the best balance of stability, comfort, and minimal adverse effects. This aligns with the ethical and professional standards of orthopedic technology, which mandate patient-centered care and the application of evidence-based practices. By considering factors beyond just fracture alignment, such as patient mobility, skin integrity, and potential for secondary complications, the technologist demonstrates a commitment to holistic patient care and the prevention of iatrogenic harm. This approach ensures that the immobilization strategy is not only effective for the immediate injury, but also supports the patient's recovery and long-term functional outcomes, adhering to the principle of do no harm and promoting optimal patient well-being. Incorrect approaches analysis. An approach that solely focuses on achieving rigid immobilization without considering patient comfort or potential for secondary complications is professionally unacceptable. This fails to meet the ethical obligation to provide patient-centered care and can lead to significant adverse outcomes, such as pressure injuries, deep vein thrombosis, and joint contractures, which are preventable. Such an approach may also contravene guidelines that emphasize minimizing patient discomfort and maximizing functional preservation during the immobilization period. An approach that prioritizes speed of application over thorough patient assessment and appropriate technique selection is also professionally unsound. While efficiency is valued, it should never come at the expense of patient safety or the efficacy of the treatment. This can result in suboptimal immobilization, leading to delayed healing, malunion, or non-union, and potentially requiring more complex interventions later. It demonstrates a lack of due diligence and adherence to professional standards that require careful and considered application of orthopedic techniques. An approach that relies on outdated or unproven immobilization methods or fails to adapt to new evidence and technological advancements is professionally negligent. The field of orthopedics is constantly evolving, and technologists are expected to maintain their knowledge and skills to provide the best possible care. Sticking to outdated practices without justification can lead to suboptimal outcomes and may not align with current best practices or regulatory expectations for evidence-based care. Professional reasoning. When faced with multiple immobilization options, a professional orthopedic technologist should engage in a systematic decision-making process. This begins with a thorough understanding of the specific fracture characteristics, type, location, displacement, and the patient's overall medical status, including comorbidities, age, and activity level. Next, the technologist should evaluate the available immobilization techniques, considering their biomechanical properties, potential for complications, patient comfort, and ease of application. This evaluation should be informed by current evidence-based guidelines and best practices. The technologist should then discuss the options with the supervising physician and, where appropriate, involve the patient in the decision-making process, explaining the rationale behind the chosen method. Finally, ongoing monitoring of the patient for any signs of complications or discomfort is crucial, with prompt adjustments to the immobilization strategy as needed. Question 6. The control framework reveals that patient with a complex comminuted tibial fracture, who has been thoroughly assessed, and for whom a specific intramedullary nail fixation is recommended due to its superior stability and load-bearing capacity, expresses a strong preference for a simpler plate and screw fixation, citing concerns about the invasiveness of the intramedullary nail procedure. As a registered orthopedic technologist, ROT, how should you ethically and professionally proceed? Option A. Proceed with the plate and screw fixation as requested by the patient, prioritizing their expressed preference over the recommended surgical plan to avoid conflict. Option B. Engage in a detailed discussion with the patient, explaining the biomechanical advantages of the intramedullary nail for their specific fracture type, outlining the potential risks of delayed union or non-union with plate fixation, and exploring their concerns to facilitate an informed shared decision. Option C. Inform the patient that their preference cannot be accommodated due to the complexity of the fracture, and proceed with the intramedullary nail fixation as planned by the orthopedic surgeon. Option D. Advise the patient that the decision is solely theirs, and provide them with information on both fixation methods without offering any professional recommendation or further discussion. The correct answer is B. Engage in a detailed discussion with the patient, explaining the biomechanical advantages of the intramedullary nail for their specific fracture type, outlining the potential risks of delayed union or non-union with plate fixation, and exploring their concerns to facilitate an informed shared decision. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the technologist's professional judgment regarding the optimal management of a complex fracture. The technologist must navigate the ethical imperative to respect patient autonomy while upholding their responsibility to provide care aligned with established orthopedic principles and best practices, as dictated by the Registered Orthopaedic Technologist (ROT) regulatory framework. The technologist's role involves not just technical execution, but also patient education and advocacy, ensuring informed consent and understanding of treatment implications. The correct approach represents best professional practice because it prioritizes patient-centered care and informed decision-making. By engaging in open and honest communication, the technologist facilitates the patient's understanding of the risks and benefits associated with different fracture management options, including the potential for delayed healing or non-union if a less stable fixation method is chosen against professional advice. This aligns with the ROT's ethical guidelines, which emphasize patient education, shared decision-making, and acting in the patient's best interest while respecting their autonomy. The technologist's role is to provide expert guidance, not to dictate treatment, thereby empowering the patient to make a choice that is both informed and aligned with their values. An incorrect approach that involves overriding the patient's wishes and proceeding with the technically simpler fixation without further discussion would be a significant ethical and regulatory failure. This disregards the fundamental principle of patient autonomy, a cornerstone of healthcare ethics and professional conduct. It also fails to uphold the ROT's responsibility to ensure the patient is fully informed about their treatment options and the potential consequences of their choices. Such an action could be construed as paternalistic and could lead to patient dissatisfaction, distrust, and potentially adverse outcomes if the chosen fixation proves inadequate for the fracture type. Another incorrect approach, such as dismissing the patient's concerns about the complexity of the fixation and proceeding without adequate explanation, also constitutes a regulatory and ethical failure. This demonstrates a lack of empathy and a failure to adequately address the patient's anxieties. The ROT is obligated to ensure the patient understands the rationale behind the recommended fixation method and to address any fears or misconceptions they may have. Failing to do so undermines the trust essential for a therapeutic relationship and can lead to non-compliance or a feeling of being unheard. The professional reasoning process in such a situation should involve a structured approach. First, actively listen to and acknowledge the patient's concerns and preferences. Second, clearly and concisely explain the orthopedic rationale for the recommended fixation method, detailing the specific fracture characteristics and why the proposed method offers the best chance for optimal healing and functional recovery. Third, discuss the potential risks and benefits of alternative fixation methods, including the increased likelihood of complications if a less robust option is chosen. Fourth, explore the patient's underlying reasons for their preference, seeking to understand if there are any misconceptions or external pressures influencing their decision. Finally, collaboratively work towards a shared decision that respects the patient's autonomy while ensuring they are making an informed choice based on sound medical advice. Question 7. Cost-benefit analysis shows that while initial plain radiography is cost-effective for many suspected fractures, the potential for delayed diagnosis and subsequent complications from subtle or complex injuries necessitates a nuanced approach to diagnostic imaging selection for orthopedic technologists. Considering the overview of the skeletal system and the principles of patient care, which of the following best reflects the optimal decision-making process for an orthopedic technologist when faced with a patient presenting with a suspected limb injury where initial plain radiographs are equivocal? Option A. Proceed with conservative management based on the equivocal plain radiographs, assuming the injury is minor and will resolve without further investigation. Option B. Document the equivocal findings and advise the patient to return only if symptoms significantly worsen, deferring further diagnostic steps. Option C. Recommend advanced imaging modalities such as CT or MRI if clinical suspicion remains high despite equivocal plain radiographs to ensure definitive diagnosis and appropriate treatment planning. Option D. Immediately escalate to the most advanced and comprehensive imaging available, regardless of the specific clinical presentation, to avoid any possibility of mispathology. The correct answer is C. Recommend advanced imaging modalities such as CT or MRI if clinical suspicion remains high despite equivocal plain radiographs to ensure definitive diagnosis and appropriate treatment planning. Explanation. This scenario is professionally challenging because it requires an orthopedic technologist to balance the immediate need for patient care with the long-term implications of diagnostic accuracy and resource allocation. The skeletal system's complexity means that initial assessments, while often effective, may not always capture the full picture, leading to potential downstream costs if misdiagnosed or inadequately treated. Careful judgment is required to determine when a more comprehensive diagnostic approach is warranted, even if it incurs higher upfront costs. The correct approach represents best professional practice because it prioritizes patient well-being and evidence-based decision-making, aligning with the core ethical principles of the Registered Orthopaedic Technologist (ROT) profession. By advocating for advanced imaging when initial findings are inconclusive or suggest a more complex pathology, the technologist ensures that the patient receives the most appropriate and effective treatment plan. This proactive stance minimizes the risk of delayed diagnosis, ineffective treatment, and subsequent complications, ultimately leading to better patient outcomes and potentially lower long-term healthcare expenditures. This aligns with the professional duty of care and the expectation that ROTs will utilize their knowledge to optimize patient management within the established regulatory framework for orthopedic technology. An incorrect approach that relies solely on basic imaging, without considering the potential for subtle or complex fractures, demonstrates a failure to apply comprehensive knowledge of the skeletal system. This could lead to a misdiagnosis, resulting in delayed treatment, chronic pain, or functional impairment for the patient. Ethically, this is a breach of the duty of care. From a regulatory perspective, it may fall short of the expected standard of practice for a qualified ROT, potentially leading to professional review. Another incorrect approach, which involves immediately ordering the most expensive and advanced imaging for every suspected injury, is also professionally unacceptable. While thoroughness is important, this approach disregards the principle of cost-effectiveness and may lead to unnecessary healthcare expenditure and potential patient exposure to radiation without clear clinical benefit. This can be seen as a failure to exercise professional judgment and a potential violation of ethical guidelines regarding responsible resource utilization. The professional reasoning process for similar situations should involve a systematic evaluation of the patient's presentation, including mechanism of injury, clinical signs and symptoms, and initial radiographic findings. The orthopedic technologist should then consider the differential diagnoses for the observed findings, weighing the likelihood of various pathologies. This assessment should inform the decision regarding the necessity and type of further diagnostic investigation, always balancing the potential benefits to the patient against the associated risks and costs. Consultation with supervising physicians or senior colleagues is also a crucial component of this decision-making process when uncertainty exists. Question 8. Risk assessment procedures indicate that a patient presenting with acute knee pain and significant swelling reports that even light touch is currently causing discomfort. When performing a physical examination to assess the extent of the injury, which of the following approaches best balances the need for diagnostic information with patient comfort and safety? Option A. Focus exclusively on passive range of motion exercises to avoid any potential for exacerbating the patient's pain, and defer any palpation until the swelling has significantly reduced. Option B. Begin with gentle observation and palpation of surrounding, less affected areas, gradually progressing to the most painful regions with increasing but still cautious pressure, and incorporating passive range of motion only as tolerated, while continuously seeking patient feedback. Option C. Conduct a thorough palpation of the entire knee joint, including deep pressure to assess for underlying structural damage, and then proceed with forceful manipulation to determine the limits of the patient's joint mobility. Option D. Immediately proceed with a comprehensive range of motion assessment, including both active and passive movements, and apply firm palpation to identify the source of swelling and tenderness. Correct answer is B. Begin with gentle observation and palpation of surrounding, less affected areas, gradually progressing to the most painful regions with increasing but still cautious pressure, and incorporating passive range of motion only as tolerated, while continuously seeking patient feedback. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the registered orthopedic technologist, ROT, to balance the immediate need for diagnostic information with the patient's comfort and the potential for exacerbating their condition. The patient's reported pain and limited mobility necessitate a careful and sensitive approach to physical examination. The ROT must consider not only the technical aspects of the examination, but also the patient's subjective experience and the potential impact of their actions on the patient's well-being and recovery. Correct approach analysis. The correct approach involves a systematic and progressive examination, starting with less invasive techniques and gradually progressing to more involved maneuvers as tolerated by the patient. This aligns with best professional practice as it prioritizes patient comfort and safety while still aiming to gather necessary diagnostic information. This approach is ethically sound, adhering to principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. It also reflects a commitment to patient-centered care, respecting the patient's autonomy and their right to be examined in a way that minimizes distress. Regulatory frameworks for healthcare professionals, including those governing orthopedic technologists, generally emphasize the importance of performing examinations in a manner that is both effective and humane. Incorrect approaches analysis. One incorrect approach would be to immediately proceed with aggressive palpation and range of motion testing, without first assessing the patient's pain levels or explaining the procedures. This would be a failure to adhere to the principle of non-maleficence, potentially causing unnecessary pain and distress, and could be considered a breach of professional conduct by not adequately considering the patient's comfort and safety. It also undermines patient trust and the therapeutic relationship. Another incorrect approach would be to solely rely on passive range of motion without attempting any active or resisted movements, even if the patient indicates they can tolerate them. While prioritizing comfort is important, this approach might fail to gather sufficient information to accurately diagnose the underlying issue, potentially leading to delayed or incorrect treatment. This could be seen as a failure to provide competent care, as it might not meet the expected standard of diagnostic thoroughness for an orthopedic examination. A third incorrect approach would be to perform the examination in a rushed and perfunctory manner, without adequate observation of the patient's nonverbal cues or without providing clear instructions. This demonstrates a lack of professionalism and could lead to misinterpretation of findings or misdiagnostic clues. It also fails to uphold the ethical standard of providing attentive and thorough care. Professional reasoning. Professionals should employ a decision-making process that begins with a thorough patient history and a clear understanding of the presenting complaint. This should be followed by a visual inspection of the affected area. The physical examination should then proceed in a logical, systematic, and progressive manner, always prioritizing patient comfort and safety. Communication with the patient is paramount throughout the process, explaining each step and seeking their consent and feedback. If a particular maneuver causes significant pain, the professional should reassess and consider alternative methods or defer that part of the examination. This iterative process of assessment, intervention, and reassessment ensures that the examination is both diagnostically effective and ethically sound. Question 9. System analysis indicates that a registered orthopedic technologist, ROT, is presented with a case involving a patient experiencing significant pain and limited mobility following a traumatic event. The ROT needs to determine the primary tissue involved to inform subsequent diagnostic imaging and treatment recommendations. Which of the following accurately distinguishes the primary roles of the two key connective tissues involved in musculoskeletal function? Option A. Both tendons and ligaments primarily serve to provide static support to joints with minimal functional differentiation. Option B. Tendons are primarily responsible for proprioception, while ligaments are mainly involved in force transmission from muscles. Option C. Tendons primarily connect muscle to bone to facilitate movement, while ligaments primarily connect bone to provide joint stability. Option D. Ligaments are primarily responsible for transmitting muscular forces to bone, while tendons are mainly involved in limiting excessive joint motion. The correct answer is C. Tendons primarily connect muscle to bone to facilitate movement, while ligaments primarily connect bone to provide joint stability. Explanation: scenario analysis. This scenario is professionally challenging because it requires the registered orthopedic technologist, ROT, to differentiate between two critical musculoskeletal tissues with distinct roles and properties, directly impacting patient care and treatment planning. Misidentification or misunderstanding of their functions can lead to inappropriate interventions, delayed recovery, or even iatrogenic injury. The ROT must apply their foundational knowledge of orthopedic anatomy and biomechanics to accurately assess the situation and guide appropriate management. Correct approach analysis. The correct approach involves recognizing that tendons are primarily responsible for connecting muscle to bone, facilitating movement by transmitting muscular forces. Ligaments, conversely, are strong fibrous bands that connect bone to bone, providing joint stability and limiting excessive motion. Understanding this fundamental difference is crucial for an ROT when assessing injuries, assisting in surgical procedures, or educating patients about their condition. This aligns with the core competencies expected of an ROT, emphasizing accurate anatomical and functional knowledge as the basis for all clinical actions. Incorrect approaches analysis. One incorrect approach would be to conflate the roles of tendons and ligaments, assuming they both primarily provide static joint support. This demonstrates a fundamental misunderstanding of biomechanics and orthopedic anatomy, violating the professional standard of care expected of an ROT. Such a failure could lead to misdiagnosis of injuries, such as mistaking a ligamentous tear for a muscular strain, resulting in incorrect rehabilitation protocols and potentially chronic instability. Another incorrect approach would be to focus solely on the tensile strength of both tissues, without differentiating their primary functional purpose. While both are strong, their organizational structure and cellular composition are optimized for their specific roles. Ignoring this distinction would be a failure to apply a nuanced understanding of orthopedic principles, potentially leading to misinterpretations of imaging studies or surgical findings. A third incorrect approach would be to consider tendons and ligaments as interchangeable in terms of their healing potential and response to injury. While both are connective tissues, their vascularity and cellular makeup differ, influencing their regenerative capacity and the types of interventions that are most effective. Treating them as identical in this regard would be a significant professional failing, impacting treatment efficacy and patient outcomes. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough review of the patient's presentation and relevant diagnostic information. This should be followed by a clear recall and application of foundational orthopedic knowledge, specifically focusing on the distinct anatomical structures and their biomechanical functions. When faced with ambiguity, consulting with supervising orthopedic surgeons or referring to established clinical guidelines and anatomical texts is paramount. Continuous professional development and a commitment to maintaining up-to-date knowledge are essential for navigating such scenarios effectively and ethically. Question 10. Operational review demonstrates that a patient fitted with a new lower limb orthosis is reporting intermittent tingling and a sensation of coldness in the distal extremity, alongside a slight decrease in capillary refill time. Which of the following represents the most appropriate immediate action for the registered orthopedic technologist? Option A. Immediately remove the orthosis and inform the patient that they will need to wait for a follow-up appointment with the surgeon to address the issue. Option B. Advise the patient to ignore the symptoms as they are likely temporary and will resolve as the limb gets used to the orthosis. Option C. Perform a detailed neurovascular assessment of the affected limb and document findings, consulting with the supervising orthopedic surgeon regarding potential orthotic adjustments or further investigation. Option D. Increase the padding within the orthosis in the area of reported sensation without further assessment or consultation. The correct answer is C. Perform a detailed neurovascular assessment of the affected limb and document findings, consulting with the supervising orthopedic surgeon regarding potential orthotic adjustments or further investigation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the registered orthopedic technologist, ROT, to interpret and apply knowledge of the vascular and nervous supply to the musculoskeletal system in a practical, patient care context. The challenge lies in recognizing how potential compromises to these systems, even if subtle, can significantly impact patient outcomes and require specific interventions or precautions. The ROT must move beyond theoretical knowledge to practical application, considering the direct implications for patient safety and treatment efficacy. Correct approach analysis. The correct approach involves a thorough assessment of the patient's neurovascular status, specifically looking for signs and symptoms that indicate compromise to the blood supply or nerve function in the affected limb. This aligns with the fundamental ethical and professional responsibility of an ROT to ensure patient safety and optimize treatment. By identifying potential issues early, the ROT can implement appropriate management strategies, such as modifying positioning, adjusting orthotic devices, or escalating care to the orthopedic surgeon or other relevant healthcare professionals. This proactive approach directly supports the principles of patient-centered care and adherence to best practices in orthopedic technology, as implicitly guided by professional standards that prioritize patient well-being and the prevention of iatrogenic harm. Incorrect approaches analysis. One incorrect approach would be to dismiss subtle changes in sensation or circulation as insignificant or unrelated to the orthotic device. This fails to acknowledge the delicate nature of vascular and nervous structures and their susceptibility to compression or ischemia. Ethically, this constitutes a failure to provide diligent care and could lead to delayed diagnosis and treatment of serious complications, potentially violating the principle of do no harm. Another incorrect approach would be to make unilateral adjustments to the orthotic device without consulting the supervising orthopedic surgeon or physician, especially if the adjustments are based on assumptions rather than a comprehensive assessment. This bypasses established protocols for patient management and could inadvertently worsen the neurovascular compromise or create new problems. This action demonstrates a lack of professional judgment and could be seen as practicing outside the scope of practice, potentially leading to regulatory issues. A further incorrect approach would be to focus solely on the mechanical function of the orthotic device without considering its impact on the underlying biological systems. This narrow focus ignores the critical interplay between the orthosis and the patient's vascular and nervous supply, which is essential for effective and safe orthotic management. This oversight can lead to complications that undermine the very purpose of the orthotic intervention. Professional reasoning. Professionals should adopt a systematic approach that begins with a comprehensive understanding of the patient's anatomy and physiology, particularly the vascular and nervous supply relevant to the area being treated. This knowledge should then be integrated with a thorough clinical assessment, including observation, palpation, and patient-reported symptoms. When potential issues arise, professionals must employ critical thinking to differentiate between normal variations and signs of compromise. Decision-making should be guided by established protocols, a commitment to patient safety, and a willingness to consult with supervisors or other healthcare professionals when uncertainty exists. The ultimate goal is to ensure that orthotic interventions are not only mechanically sound, but also biologically safe and conducive to optimal patient recovery. Question 11. Cost-benefit analysis shows that early, aggressive surgical intervention for a neonate diagnosed with severe bilateral clubfoot offers a high probability of achieving functional correction, but carries significant risks of post-operative complications and potential for recurrent deformities requiring further procedures. Conversely, a staged, conservative management approach involving serial casting and physiotherapy is less invasive, has a lower immediate risk profile, and may achieve satisfactory functional outcomes with less long-term morbidity, though it requires sustained family commitment and may result in a less aesthetically perfect foot. Considering the regulatory framework for registered orthopedic technologists, which approach best balances immediate patient needs with long-term functional goals and ethical considerations. Option A. Advocate for immediate, aggressive surgical intervention to achieve the most complete correction possible, prioritizing the reduction of future surgical needs. Option B. Recommend a staged, conservative management approach, emphasizing patient and family education regarding commitment and potential outcomes, while closely monitoring progress and adjusting the plan as needed in consultation with the orthopedic surgeon. Option C. Advise the family that the decision is solely theirs to make, offering no professional recommendation due to the complexity of the condition. Option D. Suggest a trial of conservative management for a limited period, with a predetermined switch to surgical intervention if significant improvement is not observed within a strict time frame. The correct answer is B. Recommend a staged, conservative management approach, emphasizing patient and family education regarding commitment and potential outcomes, while closely monitoring progress and adjusting the plan as needed in consultation with the orthopedic surgeon. Explanation. This scenario presents a professional challenge due to the inherent complexity of congenital musculoskeletal disorders and the need to balance immediate patient needs with long-term functional outcomes and resource allocation. The registered orthopedic technologist, ROT, must navigate the ethical imperative of providing optimal care while adhering to established clinical guidelines and the specific regulatory framework governing their practice within the specified jurisdiction. Careful judgment is required to select interventions that are not only clinically appropriate, but also align with the patient's developmental stage, family support systems, and the available evidence base for managing such conditions. The correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary assessment and evidence-based treatment planning. This aligns with the regulatory framework's emphasis on patient-centered care, professional competence, and the ethical obligation to act in the patient's best interest. By involving a team of specialists and considering the long-term implications of treatment, the ROT ensures that the chosen course of action is informed, holistic, and aims to maximize the patient's functional independence and quality of life, thereby upholding the standards of care expected of a registered orthopedic technologist. An incorrect approach that focuses solely on immediate symptom relief without a thorough diagnostic workup and long-term prognosis fails to meet the regulatory requirement for comprehensive patient assessment and evidence-based practice. This could lead to suboptimal outcomes, unnecessary interventions, and potential harm to the patient. Another incorrect approach that disregards the input of other specialists or the patient's family ignores the ethical principle of collaboration and shared decision-making, potentially undermining trust and leading to non-adherence to treatment plans. A third incorrect approach that relies on anecdotal evidence or unproven techniques violates the professional obligation to practice within the scope of established, evidence-based orthopedic technology and could expose the patient to risks without demonstrable benefit, contravening regulatory guidelines on patient safety and professional conduct. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understanding the patient's condition and history. Second, consulting relevant clinical guidelines and evidence-based literature. Third, engaging in open communication with the patient and their family to understand their goals and concerns. Fourth, collaborating with the multidisciplinary team to develop a comprehensive treatment plan. And finally, documenting all assessments, decisions, and interventions meticulously, ensuring compliance with all applicable regulations and ethical standards. Question 12. The evaluation methodology shows a patient presenting with persistent joint pain, swelling, and stiffness, particularly in the morning, along with fatigue and a history of occasional fevers. The orthopedic technologist is tasked with contributing to the initial assessment and management planning for this individual. Which of the following approaches best reflects a comprehensive risk assessment for rheumatoid arthritis, considering its pathophysiology and management? Option A. Focus on identifying and managing potential triggers for joint inflammation, such as dietary factors or environmental exposures, while monitoring symptom fluctuations. Option B. Recommend immediate initiation of high-dose corticosteroid therapy to rapidly reduce inflammation and alleviate symptoms, pending further specialist consultation. Option C. Prioritize a detailed assessment of the patient's functional limitations and pain levels, correlating these with imaging findings to guide surgical intervention recommendations. Option D. Conduct a thorough evaluation including a detailed patient history, physical examination, review of relevant laboratory markers, e.g., RF, anti-CCP, and imaging, to inform a collaborative management plan that addresses disease modification and symptom control. The correct answer is C. Prioritize a detailed assessment of the patient's functional limitations and pain levels, correlating these with imaging findings to guide surgical intervention recommendations. Explanation. The evaluation methodology shows a patient presenting with symptoms suggestive of rheumatoid arthritis, RA, a chronic autoimmune disease affecting the joints. The professional challenge lies in accurately assessing the patient's risk factors and current disease activity to guide appropriate management, which requires a nuanced understanding of RA pathophysiology and adherence to established clinical guidelines. This scenario demands a comprehensive risk assessment that considers both the patient's individual characteristics and the disease's progression. The correct approach involves a multifaceted risk assessment that integrates patient history, physical examination findings, laboratory results, such as rheumatoid factor and anti-CCP antibodies, and imaging studies. This comprehensive evaluation allows for an accurate diagnosis, staging of the disease, and identification of prognostic indicators. By understanding the pathophysiology of RA, including the inflammatory cascade and its impact on joint structures, the orthopedic technologist can contribute to a management plan that prioritizes early intervention with disease-modifying antirheumatic drugs, DMARD, to slow disease progression, manage pain, and preserve joint function. This aligns with best professional practice by ensuring patient-centered care, evidence-based decision-making, and adherence to the principles of orthopedic technology as defined by professional standards and ethical codes, which emphasize patient well-being and optimal outcomes. An incorrect approach would be to solely rely on subjective patient complaints without objective assessment. This fails to acknowledge the objective markers of inflammation and joint damage characteristic of RA, potentially leading to delayed or inappropriate treatment. Ethically, this approach neglects the professional responsibility to conduct a thorough and evidence-based assessment. Another incorrect approach is to focus exclusively on symptomatic relief without addressing the underlying autoimmune process. This overlooks the critical need for disease modification, which is central to managing RA and preventing long-term joint destruction. Such an approach would violate professional standards by not employing the most effective strategies for managing a chronic inflammatory condition. A third incorrect approach might be to recommend specific treatments without consulting or collaborating with the supervising orthopedic surgeon or rheumatologist. This oversteps the scope of practice for an orthopedic technologist and could lead to conflicting or harmful treatment plans, violating professional boundaries and potentially patient safety regulations. The professional decision-making process for similar situations should involve a systematic approach. First, gathering all relevant patient information, history, symptoms, previous treatments. Second, performing a thorough physical examination. Third, interpreting diagnostic test results in conjunction with clinical findings. Fourth, collaborating with the multidisciplinary team, physicians, therapists, to formulate a comprehensive management plan. And fifth, continuously monitoring the patient's response to treatment and adjusting the plan as needed. This iterative process ensures that care is tailored to the individual patient's needs and reflects the current understanding of RA pathophysiology and management. Question 13. The control framework reveals that a patient presents with anterior knee pain, with symptoms exacerbated by squatting and climbing stairs. The referring physician has requested a comprehensive assessment of potential meniscal and pedalofemoral pathologies. Which approach to special testing best aligns with best practice for an orthopedic technologist in this scenario? Option A. Ask the patient to describe their pain in detail, and then perform the patellar apprehension test and the Thessley test based on their description. Option B. Select a variety of common knee special tests at random, including the valgus stress test and the posterior drawer test, to cover all possibilities. Option C. Administer the Latchman test and anterior drawer test to rule out ligamentous instability, as this is a common cause of knee pain. Option D. Systematically perform the McMurray test, applies compression test, and the patellar grind test, documenting all findings and noting any reproduction of the patient's reported pain. The correct answer is D. Systematically perform the McMurray test, applies compression test, and the patellar grind test, documenting all findings and noting any reproduction of the patient's reported pain. Explanation. Scenario analysis. This scenario presents a common challenge in orthopedic technology, accurately identifying the source of a patient's pain and dysfunction. The challenge lies in the potential for overlapping symptoms between different injuries, requiring a systematic and evidence-based approach to special testing. Misinterpretation or incomplete assessment can lead to delayed or incorrect diagnoses, impacting patient outcomes and potentially violating professional standards of care. Correct approach analysis. The correct approach involves a comprehensive and sequential application of special tests, starting with those that are most sensitive and specific for the suspected injury, while also considering differential diagnoses. This methodical process, grounded in established orthopedic assessment protocols, ensures that the technologist gathers sufficient, reliable data to inform the referring physician. Adherence to these established protocols aligns with the professional duty of care and the regulatory expectation that orthopedic technologists practice within their scope and utilize evidence-based techniques. Incorrect approach is analysis, performing only a single special test without considering others' risks, missing crucial diagnostic information, or misinterpreting a positive result. This could lead to an incomplete picture for the physician, potentially delaying appropriate treatment and failing to meet the standard of care expected of a registered orthopedic technologist. Ethically, this approach demonstrates a lack of diligence. Selecting special tests based solely on patient self-report without a structured assessment framework can be unreliable. While patient history is vital, it must be corroborated by objective findings. Relying solely on subjective input without objective testing may lead to an inaccurate assessment, potentially violating the principle of providing competent care. Randomly applying a series of special tests without a logical sequence or consideration for differential diagnoses is inefficient and can lead to confusion. This approach lacks the systematic rigor expected in clinical assessment and may not yield the most pertinent information for the physician, potentially falling short of professional standards. Professional reasoning. Professionals should approach special testing with a structured methodology. This begins with a thorough patient history and physical examination to form a differential diagnosis. Based on this, a targeted selection and sequence of special tests should be employed, prioritizing those with higher sensitivity and specificity for the most likely conditions. Documentation of all tests performed, their results, and the technologist's observations is critical for clear communication with the referring physician and for patient record keeping. This systematic, evidence-based approach ensures accurate data collection and supports effective patient management. Question 14. Quality control measures reveal inconsistencies in the classification of bone specimens observed during routine orthopedic assessments. A particular specimen exhibits a dense, compact outer layer and a porous, spongy inner structure with a prominent medullary cavity. This specimen is consistently being misidentified. Which of the following best describes the likely bone type and its characteristic features, leading to accurate classification? Option A. Irregular bone characterized by complex shapes that do not fit into other categories, often with varied proportions of compact and spongy bone. Option B. Long bone characterized by a shaft diaphysis and two expanded ends epiphyses, primarily composed of compact bone externally and spongy bone internally, housing a medullary cavity. Option C. Short bone, characterized by cuboidal shape and composed of spongy bone covered by a thin layer of compact bone, providing stability and some movement. Option D. Flat bone, characterized by two thin layers of compact bone sandwiching a layer of spongy bone, providing protection and broad surfaces for muscle attachment. The correct answer is B. Long bone characterized by a shaft diaphysis and two expanded ends epiphyses, primarily composed of compact bone externally and spongy bone internally, housing a medullary cavity. Explanation. This scenario presents a challenge in accurately identifying and documenting bone types, which is fundamental to orthopedic technology. Misidentification can lead to incorrect treatment planning, inappropriate device selection, and ultimately, suboptimal patient outcomes. The professional challenge lies in applying theoretical knowledge of bone morphology and histology to practical clinical observations and diagnostic imaging, ensuring adherence to established protocols for documentation and communication within the orthopedic team. The correct approach represents best professional practice by demonstrating a thorough understanding of bone classification and their characteristic features. This allows for precise identification, which is crucial for accurate record keeping and effective collaboration with orthopedic surgeons and other healthcare professionals. Adherence to established diagnostic criteria and documentation standards ensures that all team members are working with consistent and reliable information, directly supporting patient safety and quality of care, as mandated by professional standards for registered orthopedic technologists. An incorrect approach that relies solely on superficial visual assessment, without considering underlying structural characteristics or histological differences would be professionally unacceptable. This failure to apply a systematic and evidence-based identification process could lead to misdiagnosis and inappropriate interventions, violating the duty of care owed to the patient. Another incorrect approach, such as documenting a bone type based on a common but not definitive characteristic, risks oversimplification and overlooks critical distinctions that may impact treatment. This demonstrates a lack of due diligence and a failure to meet the expected standard of expertise for a registered orthopedic technologist. Furthermore, failing to consult relevant diagnostic imaging or patient history when identifying bone types represents a significant lapse in professional judgment and a deviation from best practices in orthopedic assessment. The professional reasoning process for similar situations should involve a systematic evaluation of all available data. This includes reviewing patient history, physical examination findings, and critically analyzing diagnostic imaging, e.g., X-rays, CT scans, MRI. When classifying bone types, professionals should consider their location, shape, size, and characteristic histological features, if applicable and observable through imaging. Cross-referencing findings with established anatomical and pathological references is essential. Clear, concise, and accurate documentation is paramount, ensuring that all observations are recorded according to established protocols and communicated effectively to the interdisciplinary team. Question 15. The monitoring system demonstrates that a patient undergoing post-operative orthopedic rehabilitation has achieved only 70% of their projected functional outcome milestones at the expected time point, with subjective reports indicating persistent discomfort during specific exercises. Which of the following represents the most appropriate next step in optimizing the rehabilitation process? Option A. Focus solely on pain management techniques and postpone further functional progression until all discomfort is completely resolved. Option B. Continue with the current rehabilitation protocol as scheduled, assuming the patient will eventually catch up to the projected milestones. Option C. Conduct a comprehensive reassessment of the patient's current functional capacity, review the established rehabilitation goals in light of the new data, and modify the treatment plan to address specific limitations and patient feedback. Option D. Immediately reduce the intensity and complexity of all prescribed exercises due to the patient's reported discomfort, without further assessment. The correct answer is C. Conduct a comprehensive reassessment of the patient's current functional capacity, review the established rehabilitation goals in light of the new data, and modify the treatment plan to address specific limitations and patient feedback. Explanation. Scenario analysis. This scenario presents a common challenge in orthopedic rehabilitation where patient progress may not align with initial expectations, requiring the orthopedic technologist to critically evaluate the rehabilitation plan and patient response. The challenge lies in balancing the need for consistent application of established principles with the necessity of individualizing care based on objective and subjective patient feedback, all while adhering to professional standards and ethical obligations. Correct approach analysis. The correct approach involves a systematic review of the patient's current functional status, reassessment of the established rehabilitation goals, and modification of the treatment plan based on evidence-based practice and the patient's specific needs and responses. This aligns with the core principles of rehabilitation, emphasizing patient-centered care, progressive overload, and functional restoration. It also reflects the professional responsibility of an orthopedic technologist to ensure that interventions are effective, safe, and tailored to the individual, thereby optimizing outcomes and adhering to best practice guidelines. Incorrect approaches analysis. One incorrect approach involves continuing the current rehabilitation plan without modification, despite evidence of plateaued progress. This fails to acknowledge the dynamic nature of rehabilitation and the need for adaptation. Ethically, it could be considered a failure to provide competent care, as it does not respond to the patient's needs. Legally, it might be viewed as a deviation from the standard of care if it leads to suboptimal outcomes or prolonged recovery. Another incorrect approach is to prematurely discontinue or significantly alter the rehabilitation program based on a single observation or patient complaint without thorough reassessment. This demonstrates a lack of clinical judgment and may undermine the patient's progress and confidence in the treatment. It disregards the established principles of gradual progression and the importance of a structured rehabilitation process. A third incorrect approach is to solely rely on the patient's subjective reporting of pain or fatigue without objective functional assessment to guide modifications. While patient feedback is crucial, it must be integrated with objective measures to ensure a comprehensive understanding of the patient's status and to avoid over- or undertreatment. This approach risks misinterpreting the patient's experience and making decisions that are not fully supported by clinical evidence. Professional reasoning. Professionals should approach such situations by first gathering all available data, including objective measurements, patient-reported outcomes, and observations of functional performance. This data should then be analyzed against the established rehabilitation goals and evidence-based practice guidelines. A collaborative discussion with the patient about their progress and concerns is essential. Based on this comprehensive assessment, the professional should then formulate a revised plan, which may involve adjusting exercise intensity, frequency, duration, or introducing new therapeutic modalities. This systematic, evidence-informed, and patient-centered approach ensures that care remains effective, ethical, and aligned with professional responsibilities. Question 16. Stakeholder feedback indicates that patients presenting with acute knee pain often describe a popping sensation followed by swelling and difficulty bearing weight. When assessing such a patient, which of the following approaches best reflects an understanding of the underlying anatomy and physiology of the musculoskeletal system to guide further orthopedic assessment? Option A. Focusing primarily on the patient's description of pain intensity and location, assuming it is a general inflammatory response without further anatomical consideration. Option B. Immediately concluding that the symptoms indicate a fracture of the distal femur or proximal tibia based on the popping sound, without evaluating other potential causes. Option C. Prioritizing the orthopedic surgeon's initial impression of a sprain and documenting the patient's pain level without conducting a detailed anatomical and physiological assessment of the knee joint. Option D. Correlating the reported popping sensation and subsequent symptoms with potential damage to intra-articular structures such as the meniscus or ligaments, considering the biomechanical forces involved in knee flexion and rotation. The correct answer is D. Correlating the reported popping sensation and subsequent symptoms with potential damage to intra-articular structures such as the meniscus or ligaments, considering the biomechanical forces involved in knee flexion and rotation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the registered orthopedic technologist, ROT, to interpret and apply complex anatomical and physiological knowledge in a patient-facing context, directly impacting patient care and outcomes. The challenge lies in accurately identifying the underlying physiological dysfunction based on observed signs and symptoms, and then communicating this understanding effectively to the patient and the orthopedic surgeon. Misinterpretation can lead to delayed or incorrect treatment, patient dissatisfaction, and potential harm, necessitating a high degree of diagnostic acumen and communication skill. Correct approach analysis. The correct approach involves a systematic assessment of the patient's reported symptoms and observed physical signs, correlating them with the known anatomy and physiology of the affected joint. This includes understanding the biomechanics of the knee, the function of its ligaments, menisci, and articular cartilage, and how pathology in these structures would manifest. By identifying the specific structures likely involved, e.g., medial meniscus tear, and the associated physiological consequences, e.g., pain, effusion, mechanical locking, the ROT can provide a targeted and accurate preliminary assessment to the orthopedic surgeon. This aligns with professional standards of practice for orthopedic technologists, which mandate a thorough understanding of musculoskeletal anatomy and physiology to support diagnostic and treatment processes. It also upholds the ethical principle of beneficence by ensuring the patient receives the most appropriate and timely care. Incorrect approach is analysis. An approach that focuses solely on the patient's subjective report of pain without considering objective physical findings or underlying anatomical structures fails to meet the professional standards of an ROT. This is a regulatory failure as it bypasses the requirement for a comprehensive assessment and demonstrates a lack of understanding of musculoskeletal pathophysiology. Ethically, it risks misdiagnosis and inadequate treatment, violating the principle of non-maleficence. An approach that immediately assumes a specific diagnosis without a thorough assessment of the patient's signs and symptoms, and without considering alternative explanations based on anatomical and physiological principles, is also professionally unacceptable. This demonstrates a lack of critical thinking and a potential bias, which can lead to diagnostic errors. It is a regulatory failure to not follow a systematic assessment process, and an ethical failure to not act with due diligence. An approach that prioritizes the orthopedic surgeon's immediate assumptions over a detailed patient assessment and physiological correlation is a significant professional failing. While collaboration is crucial, the ROT has a responsibility to contribute their expertise based on their understanding of anatomy and physiology. Ignoring patient-specific data and physiological principles in favor of preconceived notions is a regulatory lapse in professional responsibility and an ethical breach of patient advocacy. Professional reasoning. Professionals should employ a structured decision-making process that begins with a comprehensive patient history and physical examination. This should be followed by a critical analysis of the findings through the lens of musculoskeletal anatomy and physiology. Considering differential diagnoses, the ROT should then formulate a preliminary assessment, clearly articulating the rationale based on physiological principles, and communicate this to the supervising orthopedic surgeon. This iterative process of assessment, analysis, and communication ensures that patient care is evidence-based, ethically sound, and aligned with regulatory requirements. Question 17. Compliance review shows that for an upcoming elective hip arthroplasty, the registered orthopedic technologist, ROT, has initiated the preoperative preparation process. The ROT has reviewed the surgical schedule and confirmed the availability of the primary implant. However, the ROT has not yet conducted a detailed patient interview to ascertain any new medical conditions, allergies, or previous adverse reactions to anesthesia. Nor has the ROT confirmed the patient's understanding of the surgical procedure and postoperative care instructions. Which of the following represents the most appropriate and compliant course of action for the ROT at this stage? Option A. Immediately proceed with scheduling the patient for the surgery as the primary implant is confirmed and the surgical date is set. Option B. Delegate the task of patient history, taking to a junior assistant to expedite the preoperative process. Option C. Inform the surgeon that the implant is available and request that they directly address the patient's medical history and understanding of the procedure. Option D. Prioritize conducting a comprehensive patient interview to gather essential medical history and assess understanding, and document these findings thoroughly before proceeding with further preparation. Correct answer is A. Immediately proceed with scheduling the patient for the surgery as the primary implant is confirmed and the surgical date is set. Explanation. This scenario presents a professional challenge due to the critical nature of preoperative assessment and preparation in ensuring patient safety and optimal surgical outcomes. The registered orthopedic technologist, ROT, must navigate potential communication breakdowns, varying patient understanding, and the need to adhere strictly to established protocols and regulatory guidelines. Careful judgment is required to identify and address all necessary preoperative requirements without compromising patient care or regulatory compliance. The correct approach represents best professional practice because it prioritizes a comprehensive and documented preoperative assessment that directly addresses the patient's specific needs and surgical plan. This aligns with the fundamental ethical obligation to provide competent and safe patient care, as mandated by professional standards and regulatory frameworks governing healthcare professionals. Specifically, it ensures that all relevant information is gathered, understood by the patient, and documented, facilitating effective communication among the healthcare team and minimizing the risk of adverse events. This proactive approach is essential for meeting the requirements of patient consent, risk mitigation, and adherence to established clinical pathways. An incorrect approach that fails to obtain a thorough patient history and document it meticulously represents a significant regulatory and ethical failure. This omission could lead to overlooking critical contraindications, allergies, or previous surgical complications, thereby jeopardizing patient safety and potentially violating the duty of care. Another incorrect approach that bypasses the verification of patient understanding of the procedure and postoperative expectations is ethically unsound and legally problematic. It undermines the principle of informed consent, a cornerstone of patient autonomy and a regulatory requirement. Furthermore, an approach that neglects to confirm the availability of all necessary preoperative equipment and implants, based on the specific surgical plan, demonstrates a lack of due diligence and preparedness, increasing the risk of surgical delays or complications, and failing to meet professional standards of practice. Professionals should employ a structured decision-making framework that begins with a thorough review of the patient's medical record and the surgeon's orders. This should be followed by a direct, empathetic, and clear communication with the patient to gather a comprehensive history, assess their understanding, and address any concerns. Documentation of all findings and discussions is paramount. Finally, a verification step, involving confirmation of all logistical requirements and patient readiness, ensures that the preoperative phase is completed to the highest standard of safety and compliance. Question 18. Assessment of a 7-year-old patient with a displaced supracondylar humerus fracture reveals significant swelling. The orthopedic technologist is considering the most appropriate casting technique and material to ensure effective immobilization while minimizing the risk of complications. Which of the following approaches best reflects current best practices for this specific clinical scenario? Option A. Apply a lightweight, inexpensive casting material that is quick to apply, prioritizing efficiency. Option B. Apply a fiberglass cast that is as tight as possible to prevent any movement of the fracture fragments. Option C. Apply a fiberglass cast, ensuring it is snug but not constrictive, with frequent checks for neurovascular status and allowance for swelling. Option D. Apply a rigid plaster of Paris cast, as it provides superior immobilization for this type of fracture. The correct answer is C. Apply a fiberglass cast, ensuring it is snug but not constrictive, with frequent checks for neurovascular status and allowance for swelling. Explanation. Scenario analysis. This scenario presents a common but critical challenge in orthopedic technology, selecting the most appropriate casting material and technique for a complex fracture in a pediatric patient. The challenge lies in balancing the need for effective immobilization and fracture healing with the unique physiological and anatomical considerations of a child, including skin sensitivity, growth plates, and the potential for complications like compartment syndrome. The technologist must possess a deep understanding of various casting materials and their properties, as well as the specific application techniques that minimize risk and maximize patient comfort and compliance. Failure to select the correct approach can lead to suboptimal healing, increased pain, skin breakdown, or long-term functional deficits. Correct approach analysis. The correct approach involves a thorough assessment of the fracture type, location, and the patient's age and overall condition. For a pediatric supracondylar humerus fracture, which is prone to swelling and neurovascular compromise, a lightweight, breathable, and easily adjustable casting material like fiberglass is often preferred. The application technique should prioritize minimizing pressure points, allowing for expansion to accommodate swelling, and ensuring adequate visualization of the distal neurovascular status. This aligns with best practices in pediatric orthopedics, emphasizing patient safety, comfort, and optimal functional outcomes. Adherence to established protocols for pediatric casting and continuous monitoring for complications are paramount. Incorrect approaches analysis. Applying a rigid plaster of Paris cast without considering the potential for swelling in a pediatric supracondylar humerus fracture is a significant regulatory and ethical failure. Plaster is less conformable and breathable than fiberglass, increasing the risk of pressure sores and compartment syndrome, especially in a child where swelling can be rapid and severe. This approach neglects the specific vulnerabilities of pediatric patients and deviates from established best practices for managing such fractures. Using a cast that is too tight, regardless of material, is a direct violation of patient care standards and ethical obligations. Excessive tightness can impede circulation, leading to neurovascular compromise, pain, and tissue damage. This demonstrates a lack of attention to detail and a failure to perform proper post-application checks, which are critical for patient safety. Choosing a casting material solely based on cost or ease of application, without considering its suitability for the specific fracture and patient demographic, is also professionally unacceptable. While cost-effectiveness is a consideration in healthcare, it must never supersede patient safety and the efficacy of treatment. This approach prioritizes administrative or personal convenience over the patient's well-being, and can lead to suboptimal outcomes and potential harm. Professional reasoning. Professionals should approach such situations by first conducting a comprehensive patient and fracture assessment. This includes reviewing imaging, understanding the mechanism of injury, and considering the patient's age, activity level, and any coexisting conditions. Next, they should consult relevant clinical guidelines and evidence-based practice for the specific injury and patient population. The decision-making process should then involve weighing the advantages and disadvantages of different casting materials and techniques against the patient's specific needs and risks. Finally, continuous monitoring and reassessment of the cast and the patient's condition are crucial throughout the treatment period. Question 19. Comparative studies suggest that patient history taking is a critical component of effective orthopedic care, yet patients may sometimes be reluctant to share certain details. If a registered orthopedic technologist is conducting a preoperative assessment and the patient becomes evasive when asked about previous injuries to the same limb, what is the most appropriate course of action to ensure both patient comfort and comprehensive data collection? Option A. Express frustration with the patient's lack of cooperation and insist that all questions must be answered before proceeding with the assessment. Option B. Gently explain the importance of understanding all previous injuries, even seemingly minor ones, for surgical planning and recovery, and encourage them to share any relevant information they recall. Option C. Proceed with the current assessment, assuming that any significant past injuries would have been previously documented or are not relevant to the current procedure. Option D. Acknowledge the patient's discomfort and immediately stop asking further questions about past injuries, focusing only on the current complaint. The correct answer is B. Gently explain the importance of understanding all previous injuries, even seemingly minor ones, for surgical planning and recovery, and encourage them to share any relevant information they recall. Explanation. Scenario analysis. This scenario presents a professional challenge due to the conflict between a patient's stated preference and the orthopedic technologist's professional judgment regarding the completeness and accuracy of the patient's history. The technologist must balance respecting patient autonomy with their ethical and professional responsibility to obtain accurate and relevant information crucial for safe and effective patient care. Failure to obtain a comprehensive history can lead to misdiagnosis, inappropriate treatment, or adverse outcomes, all of which have regulatory and ethical implications. Correct approach analysis. The correct approach involves gently but firmly guiding the patient back to providing the necessary historical details. This upholds best professional practice by prioritizing patient safety and the integrity of the clinical record. It aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Specifically, within the regulatory framework for registered orthopedic technologists, obtaining a thorough patient history is a fundamental requirement for competent practice, ensuring that all relevant factors influencing treatment are considered. This approach respects the patient's dignity while ensuring the technologist fulfills their professional duty. Incorrect approaches analysis. One incorrect approach involves accepting the patient's refusal to provide further details without further inquiry. This is professionally unacceptable as it compromises the quality of care by potentially overlooking critical information. It violates the professional obligation to gather a complete history, which is a cornerstone of safe practice and is often implicitly or explicitly required by professional standards and regulatory bodies. This could lead to a breach of professional duty if an adverse event occurs due to incomplete information. Another incorrect approach is to dismiss the patient's concerns and proceed with the examination without addressing the historical gap. This demonstrates a lack of empathy and disrespect for the patient's experience, potentially damaging the therapeutic relationship. Ethically, it fails to acknowledge the patient's right to be heard and understood. From a regulatory standpoint, it signifies a failure to adhere to the principles of patient-centered care and may fall short of the expected standard of professional conduct. A further incorrect approach is to become confrontational or judgmental about the patient's reluctance. This is unprofessional and counterproductive, likely to alienate the patient further and hinder the collection of any useful information. It breaches the ethical principle of maintaining a professional and respectful demeanor and could be seen as a failure to uphold the standards of professional conduct expected of a registered orthopedic technologist. Professional reasoning. Professionals should approach such situations with a combination of empathy, assertiveness, and a clear understanding of their professional obligations. The decision-making process should involve 1. Recognizing the potential impact of incomplete history on patient care. 2. Employing active listening and empathetic communication to understand the patient's reluctance. 3. gently explaining the importance of the missing information for their specific treatment. 4. Offering reassurance and maintaining a non-judgmental stance. 5. If necessary, documenting the patient's refusal and the technologist's attempts to obtain the information, and consulting with a supervisor or senior clinician if concerns persist. Question 20. The efficiency study reveals that the orthopedic technologist team is experiencing delays in managing patients diagnosed with osteoporosis. To optimize patient care pathways, which of the following sequences of actions best reflects a best practice approach for an orthopedic technologist in assessing and contributing to the management of an osteoporosis patient? Option A. Initiate a comprehensive assessment of the patient's individual risk factors for osteoporosis. Interpret relevant diagnostic findings in conjunction with the orthopedic physician, and collaborate on selecting evidence-based treatment strategies, including lifestyle modifications and appropriate interventions within the OT scope of practice. Option B. Rely exclusively on the patient's self-reported history of bone pain to initiate a treatment plan for osteoporosis. Option C. Focus solely on providing the patient with a walker and information on fall prevention techniques, deferring all other diagnostic and treatment considerations to the orthopedic physician. Option D. Immediately prescribe a high-dose calcium supplement and recommend weight-bearing exercises without further patient evaluation or physician consultation. The correct answer is A. Initiate a comprehensive assessment of the patient's individual risk factors for osteoporosis. Interpret relevant diagnostic findings in conjunction with the orthopedic physician, and collaborate on selecting evidence-based treatment strategies, including lifestyle modifications and appropriate interventions within the OT scope of practice. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an orthopedic technologist to synthesize information from various sources, including patient history, diagnostic imaging, and current clinical guidelines, to formulate an appropriate management plan for osteoporosis. The challenge lies in accurately identifying risk factors, interpreting diagnostic findings, and selecting evidence-based treatment options within the scope of practice for an OT, while adhering to the specific regulatory framework governing their practice. Misinterpretation or misapplication of these elements can lead to suboptimal patient outcomes or regulatory noncompliance. Correct approach analysis. The correct approach prioritizes a comprehensive assessment of the patient's individual risk factors for osteoporosis, which is fundamental to effective management. This includes considering age, sex, family history, lifestyle factors, diet, exercise, smoking, alcohol intake, and medical history, e.g., previous fractures, certain medical conditions, medications. Following this, the approach correctly emphasizes the interpretation of diagnostic tools, such as bone mineral density, BMD scans, e.g., DEXA scans, in conjunction with clinical assessment to confirm diagnosis and stratify fracture risk. Finally, it advocates for the selection of evidence-based treatment strategies, which may include lifestyle modifications, pharmacological interventions, and appropriate assistive devices, all within the OT's scope of practice and in collaboration with the orthopedic physician. This aligns with the principles of patient-centered care and evidence-based practice mandated by professional OT standards and regulatory bodies. Incorrect approaches analysis. One incorrect approach might involve solely relying on a patient's self-reported symptoms without objective diagnostic confirmation. This fails to meet the diagnostic criteria for osteoporosis and bypasses essential regulatory requirements for evidence-based diagnosis, potentially leading to inappropriate treatment or delayed diagnosis of a serious condition. Another incorrect approach could be to recommend aggressive pharmacological interventions without a thorough assessment of individual risk factors and contraindications, or without consulting the orthopedic physician. This exceeds the typical scope of practice for an OT and disregards the need for physician oversight in prescribing certain medications, violating professional conduct guidelines and potentially patient safety regulations. A third incorrect approach might be to focus exclusively on assistive devices without addressing the underlying bone density issues or other modifiable risk factors. While assistive devices are important for fall prevention and fracture management, they do not constitute a complete treatment plan for osteoporosis and neglect the comprehensive care expected of an OT. This approach fails to adhere to the holistic and evidence-based treatment principles required by the profession. Professional reasoning. Professionals should adopt a systematic approach. First, gather all available patient data, including medical history, lifestyle, and any previous diagnostic results. Second, critically evaluate this information against established diagnostic criteria and risk assessment tools for osteoporosis. Third, consult relevant clinical practice guidelines and the orthopedic physician to determine the most appropriate diagnostic steps and treatment options within the OT scope of practice. Finally, document the assessment, rationale for decision, and the treatment plan clearly and comprehensively, ensuring patient understanding and informed consent.